you, Dr. Numais. Thank you very much for accepting my invitation. Thank you and welcome to this interview.
Okay, thank you for inviting me. Okay.
All right. So, Dr. Numais, you started to be a classic medical doctor, which you still are, and your career evolved to other professional skills. You became chiropractor and you became osteopath. First, before we start to talk about chiropractor and osteopath, I would like to know your background in classic Western medical doctor. When did you decide to become a doctor and what happened?
I passed out from Columbia University from 2008. Then I worked in government sector. Then I have worked with people who affected by internal war. It was in North Province in Sri Lanka. There was a hospital conducted by international organization. So I worked with that people with 2 years in that hospital. There was a lot of doctors, from different parts of the countries. They came to Sri Lanka and they have given the good services to Sri Lankan internal displaced peoples. There was a lot of orthopedic surgeon, rheumatologists, and general physician, some physiotherapists, and chiropractors, osteopath also. Then they asked to Sri Lankan if you have interested to learn about this chiropractic, some other physical therapies. So we one of few people. Actually, we don't have any idea about chiropractic in Sri Lanka before we have ever seen. So we had a idea to have a practice, to have a training from that abroad people. So they have given a lot of training with theoretical knowledge. It was very amazed us to this kind of treatment. The patient had a good improvement with their symptomatically.
I have one question.
Yeah.
You told us that you were in a special hospital. For the benefit of the international audience, this hospital, what kind of patient was there and why people from abroad was there? It was a war hospital, displaced people hospital?
This is an international organization. They are giving medical services. Those who affected by natural disaster and internal war like the ethnic crisis. So that kind of services are they are giving the countries, affected countries. There was a war period, so we don't have enough facilities to set up a hospital in northern province. Then they had come and they started to the services, free services to the people. We have combined some other hospitals also. And emergency, actually it was the emergency care.
What kind of patient that was going there? Patient that was affected by natural disasters and war, is it?
Yeah, there's a main, we had the main patients from the musculoskeletal system and nervine disorders like the back pain and neck stiffness through the long-term cycle conditions and frozen shoulder and chronic headaches and thoracic regional pain and knee pain also.
Right. So you went there and you see the practices of these doctors that were using only their hands, is it? So they were having no equipment than their hands.
These are very interesting things. They have trained us for the purpose of, if after their services, if anything happened to Sri Lanka, even like disaster, earthquake, like tsunami. So now we don't have any resources. Now we have only doctors. We don't have medications. We don't have the internal transportation. We don't have any medical assistant. We don't have any drugs. But we have only our hand. And we have a lot of patients. So how can we how can we deliver our services to the patients with our hand? That is the reason they have given the knowledge about this chiropractic. Chiro means hand, practic meaning done by hand. This is the things.
But you had no idea of that before, right? It was the first time and you didn't know about that.
No, we don't have any idea about this because in Sri Lanka, we didn't hear about that chiropractic before 2008 and 9. Even we don't have any diploma in our universities.
How did you react when you saw the result? Because you were attending of some international doctor doing these manipulation. Were you surprised of the result? And were you, what was in your mind when you saw these doctors?
Not only myself, some other, our staff, Sri Lankan staffs also amazed about this manipulation technique and the feedback of the patients who got the services from this system. So we don't have any word. That time we don't have any words to tell about this. Every application has very, very new, it was very amazing.
Then you decided to, you saw the result and you were attending to the healing, but you could not practice that yourself. So what kind of treatment? You told me that you went in India, right? So can you tell us about when you went to India and learned that technique? What happened at that moment?
After they have returned back to their own countries, around 2016, they have invited me again to have some clinical session in New Delhi. Then we went and we got a lot of clinical training by the same people who already conducted the theoretical knowledge to us. Then they also had a lot of clinical knowledge and practice from that.
So from that moment, you started to practice. They showed you some techniques that you started to practice, right?
Yeah, after coming back to Sri Lanka, I have started my own private.
Yeah. And do you remember the first time that you treated patient? What was your reaction? How did you feel about what you were doing? You might have been under supervision. You're laughing. You were amazed.
When I treated my first patients, so very doubtfully I started my treatment. But after finishing my treatment, they give me the good feedback. Now more than 50% I have relieved. I had a relief from my pain area. So patient give good feedback me. Then I got good confidence to have this kind of practice.
You might have been surprised at the same time because that was the first time.
Yes, I say surprised because when we giving any medication to the patients, after 2-3 days only the patient giving and calling us about their improvement. But this kind of treatments, chiropractic and osteopathy, we are directly we are getting the feedback from the patients in front of us. It's good if this feedback is good or bad, like the response we are getting from the patients.
No tablet.
That is our as a medical professional. That is our satisfaction.
No tablets. No medical. No tablet. No pharmaceutical product.
No.
Your hands.
No herbs, no other drugs around this world, nothing else. Only by hand we are healing. That is the system. That is the excellent system in my view.
So you have two different techniques. You have osteopathy and chiropractic, right? Can you talk about these two different techniques? What is it doing? What are you doing to the patient so that you get that result? What is it?
Yeah, the chiropractic mainly we are covering through the spinal cord, the abnormality of spinal cord disorders like the backache and thoracic pain and neck pain. Mainly we are detecting where is abnormal in the spinal cord, and we are reaching and we are preventing this kind of treatments. We are giving the chiropractic. We are working even muscles also. In chiropractic, we are working in the muscles also. It means the nerves from the spinal cord is supplying in specific organs. If anything abnormal happens in the spinal cord, that organs gets abnormality.
Oh.
For example, gastritis, gastroesophageal reflex. So it causes the spinal nerve, the specific spinal nerve get any subluxation in the spinal cord. So we are manipulating that abnormal part of the spinal cord. Then it will slow by slow, it will be normal. This is the way. In osteopathy, mainly we are focusing alignment corrections. In some other parts of the body, like knee joints and frozen shoulder and heel pain, some half muscle pain, hip joint, and some side back, groin trigeminal pain, like that we are giving. In osteopathy, we are more application also some energy, muscles, energy technique, and deactivation of trigger points, and sport massage also.
Okay, so you're talking about the muscle, you're talking about the spine, you're talking about also something you said, trigger point. What are the trigger points? What are these?
Yeah, trigger points mean in the body, in human body, we have the specific points in different parts of the body. Specific points in different parts of the body. So, when for example, any pain, any inflammation happens in that part of the body, the trigger points are activated. Trigger points are activated by the pain, which is situated and in local area is active. Gets active. Then, slow by slow, other trigger points also surround that area is active. Then they have network within trigger points. They have the network. So slow by slow, the networks will be big. Then pain will come worse and will come as chronic.
It will propagate.
Yeah, it will propagate. Then trigger point deactivation means, so what are the trigger points are already working in the body, which are deactivated by osteopaths. That is we are doing.
Right. So when you are treating patient, basically you are realigning the spine adjustment, you are realigning or harmonizing the muscles, and you can treat a lot of things, not only back pain, isn't it?
Yeah.
What,
Yeah, not only, yeah,
what can you treat?
Yeah, you know, there's the discovery of chiropractic by Dr. Farm. He was in 18th century. He met at one patient, the deafness, small kids. She had a patient as deafness for the small kids. Then he observed some abnormality in the vertebra, in the spinal cord. Then, without unknowing about the causes of the deafness, he just manipulated that vertebra. After 2-3 days, the patients who came with deaf to that farmer, patient has slow improvement with deafness. With next visit also, he worked with that area. Then she has a more improvement than he had before. So then he was thinking there's a connection with abnormality with spinal cord. Then only he discovered the chiropractic. So, doctor, you can see there's a picture with this connection with there's a lot of organs connection with the spinal cord.
Yes.
There are brainstem, cervical region, thoracic region, lumbar region, sacral region. For every region, there are a lot of coming to the lot of internal organs inside of the body. So if anything happens in abnormality in the spinal cord, that related organs from that specific region gets abnormal. Headaches, dizziness, blood return, gastritis, heart, chest pain, pneumonia, bronchitis, and some hemorrhoids. There are a lot of diseases we are covering by chiropractic.
You also told me that you can help with some mental conditions such as stress, such as depression, etc. Can you talk to us about that, please?
You mean the mental diseases?
Well, yes, stress is a mental disease.
Mostly for the mental conditions and elderly people, for the elderly people, mostly I'm not using for the chiropractic. I am applying small portion to the elderly people. Other than chiropractic, I am using energy healing for the depression and psychological.
So you can support them?
Yeah.
Only with your hands?
Yeah, energy healing also like that. We are not using any medications. We are breathing by our hand. We are purifying our body.
So as you are a medical doctor, we can see that you are practicing complementary therapies. You are complementing your knowledge as a doctor, because doctors is the top up of your profession. You were, before doing all of these practice, chiropractic, osteopathy, and energy healing, you were basically a doctor, so you have a very good, strong knowledge of the body, right? Then after, you are applying other method of healing, right? So are you surprised? You were not expecting to, when you started your career, because you start a career and you expect to give tablets, and I don't believe you like to give tablets, don't you?
Not only Western, some other medical system of Ayurvedic, homeopathy, that medical system have a lot of the medications, the internal medication. Even patients, when they get for the long period, for 3-4 years, any medical system which taking inside is harmful to the body. It may cause some adverse effect. So that's why I am interested with this system.
So both together.
Without any medicine, we can't cure the disease. So why want to give more drugs to the patients?
So the hand can heal the body. We can heal the body with the hands.
Yeah, we can heal by our hands, the body acknowledges.
That is a fantastic thing to discover for our patients. So our time is finished. I am very happy to have witnessed what you could do. So Dr. Numais, thank you very much. We will stop the interview right now, and I hope to see your evolution go even further in the future. Thank you very much. Goodbye for now.
Bye. Bye.